Hello and welcome. We're coming to you live from our studios here in Kokomlemle. Our digital address, GA099253. Our top stories this hour. Coronavirus tops the chat in health news of 2020, but which others have been overshadowed and require similar attention? We focus on health sector review today on the show as we find out the plans and expectations of health workers for 2021. And as the pandemic intervention of free water distribution comes to an end, some Ghanaians wanted to tarry a while longer. But at what cost? And has the previous been settled already? We talked to Ghana Water Company and NGOs in water and sanitation. And the first 31st Women Movement commemoration without founder of the NDC, Jerry John Rawlings, flag bearer for the party, John Mahama, has been standing in his stead as he calls for sustaining Mr. Rawlings' ideas and legacies. Details shortly. And the pulse is brought to you by Global Communities Dignilu, affordable, safe sanitation. Do join us on DSTV 421, GoTV 144. Remember, we're streaming live on YouTube and on our social media handles. You can send us a WhatsApp on 0540-109-009. My name is Gifty Ando Apia, and this is The Pulse. Please be my guest. Ghanaians will from today no longer enjoy the free water services following President Akufo-Addo's directive to the Ghana Water Company. The social intervention, as you know, was to caution the public against the impact of COVID-19. As this intervention comes to an end, there are some citizens in the national capital who have been reacting. JoyNews' Annabella Ohenijan has more in this report.
Government will absorb the water bills for all Ghanaians for the next 3 months, i.e. April, May and June. All water tankers, publicly and privately owned, are also going to be mobilized to ensure the supply of water to all vulnerable communities.
President Akufo-Addo announcing that government will absorb water bills for Ghanaians from May to June 2020. It was part of COVID-19 relief for the people. The intervention was then extended until 31st December 2020. As the program comes to an end, the responses from water consumers have been varied here in the capital.
I wish it to stay because it has helped a lot of us, a lot. Like washing craft, I didn't go out and go and pay for it and then fetch the water. I just fetched it free and I'm using it and then everything is cool. So I think it's supposed to stay. Yeah. They don't have to cut it out. We beg them.
But were there days where you had challenges with the flow of the water?
Yes. Yeah, there were days. Like Friday evening, then it will stop coming, and then maybe Monday or Sunday evening, then it will start coming again.
If it help, it's no help. It's no help. Right now, see it right now. You just want it right now. Is it happening all right? See, it's not coming right now. So we're in the city. You know Osu? Huh. Yeah, it's Osu, right? I have to take my bag to fresh water in the Osu area.
It has helped us in so many ways. Personally, I'm able to bathe with 2 or 3 buckets of water now. The free water policy has helped us a lot, especially we the aged. The government has done well, but I was hoping they would end it after the new year.
My house is far from where the free pipe is, so normally I don't benefit from because I can't carry my bucket or my family cannot carry their bucket and then come and fetch where the water is. So I think they're supposed to do it where it will benefit from everybody.
I didn't enjoy the free water at all. I still buy water because the owner said she feared she will pay when the free water policy ends.
Bill later. I'll be facing problem.
At first, I'll be fetching it at Asundwe. But the free water is just behind my house, so if I cross the road, I can fetch it and then come and do what I want to do with it.
Well, while others say they didn't benefit from the free water policy, those who enjoyed this policy hope it stays a bit longer despite government's decision to end it. The multi-million-dollar question is whether or not this is sustainable in the long term. Should it be extended any further, especially when the Ghana Water Company has complained for years about the huge cost of processing water given activate of illegal small-scale miners. Annabella Ohenijan reports for Joy News.
I want to hear from you. Did you, as they say, enjoy the water, the free water intervention? The number is 0540-109-009. That's 0540-109-009. Let me hear from you. I'm going to have a conversation on this, and I want you to join in. Joining me right now via Zoom is Stanley Martey. He is the Corporate Communications Manager at the Ghana Water Company Limited. I'll also have Ben Arthur, who is the Executive Secretary of Coalition of NGOs in Water and Sanitation. Mr. Martey, Merry Christmas as we're going into the new year. Happy New Year. Thank you for your time. Good afternoon.
Yes, good afternoon, and thank you very much for having me.
Great. Mr. Arthur, are you there?
Yes, I am.
Great. Good afternoon to you as well, and same wishes to you. So great to have you both. Mr. Stanley Martey, I want to start with you. Can you, or has the Ghana Water Company Limited assessed the, let's call it the project so far?
Yes, thank you very much. I think it's been good so far. It's been very, very good. Consumption went high since the inception of the policy, and we've managed it in most areas. It was only in Accra that was a bit difficult, but even that one, I think it was smooth. In most regions, what happened was most of our treatment plants are underutilized. So if consumption goes up, we are able to up production to meet the demand. But in Accra, in Greater Accra and Ashanti region, and then in the Western region, for instance, because demand far outstrips supply within these three regions, it was a bit difficult to meet the high demand after the production went up. So we resorted to rationing. And I think the rationing rather solved the problem so that everybody had access to water. You also will recollect that we actually mounted over 700 water tanks within deprived areas in the country. So we, and then we're filling them with water tanks, with water tankers, so that the consumers within a certain radius could go there to fetch. That also solved the problem. So far, for us, our assessment is that it's been very, 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 very good. We know there are challenges in some areas, but yes, there will be those challenges because those who didn't have water, or where the challenges were areas where we do not have our distribution mains. For instance, if it's a newly developed area and we don't have our distribution mains,
I mean, let's jump to Osu, for example, where in the story we just did, we heard someone talking about he actually opened the tap and there was no water flowing at all. So some place like Osu.
We had this policy run over 9 months. Okay, so if you open your tap in a day or two, or even in a week, and you didn't have water, you can't say that as a result of that you didn't benefit from the free water. No, because it ran over 9 months. Within the 9 month period, we expected that everybody benefited. Okay. And I can say on authority that every single Ghanaian benefited from the free water policy.
You can say on authority, you say. All right.
Yes, I can say that on authority. Yes.
Let me bring in Mr. Benata, who's with the Coalition of NGOs in Water and Sanitation. What is your own perspective to this particular intervention? Because the idea is that with water flowing, it improves our sanitation, doesn't it?
Thank you very much for having me. And let me correct this, that I'm not the Executive Secretary of CONIWAS.
Okay.
I'm a consultant in the wash sector, so
that's very well noted.
That is a correction I wanted to make.
No problem. Thank you.
Yes, fortunately for me, I did some work with CONIWAS trying to assess the extent to which people have benefited from the service. And what we saw on the ground, was that generally places where the infrastructure is not available, where the pipelines are not available, people are not benefiting from the service. So it's interesting. Stanley was saying that people have benefited. Yes, some people have benefited, but you can't see all the people of the country. Secondly, he's also coming from the urban sector, but we also have the rural sector. We're looking at the peri-urban communities where the infrastructure is not available. Yes, they have provided 700 tanks, but it's not in every community and area throughout the country. We went to a place like Olebu, Gonze, some places in the Gulf Central and the Gulf South area, where the infrastructure, the pipelines are not there, the tanks are not available. People are still going through their old system of looking for water and buying from some of the vendors. Of course, we went to a place like Mamprobi, where the service was there 24 hours, the tankers in places where the water was not flowing, they provide tanks. So yes, in some places people are benefiting, but it's not throughout the country. Even in Accra here, we have a situation where people have not benefited because the pipeline or the infrastructure is not available.
Was non-existent.
The tanker services are also not available. People are still buying water.
There was a bit of that the arrangements which said for those who did not have water, I mean who already didn't have water, that there was supply of water through tankers for them to have access to water. Did your assessment not pick this up as well?
Yes, there were places that we went like Gonze or Lebu area. The service didn't get to them. Even the tanker services, the poly tanks that they're supposed to mount were not there. People were not having it. In one or two places that we saw the poly tanks, it's also not filled. So for 3 weeks, people have not received the service. So that is the urban. In the rural communities, in the rural areas, it's not in every rural community that you have a borehole or a pump or pipeline. In this rural community, they still resorted to their traditional source of water, which is the dugout and the streams, which we all know the situation. So yes, it has benefited some. It seems to me that it's most places where they traditionally have the access, where it was increased, intensified. Then it expanded to a few areas where the polytanks could reach. So we try doing this, but I don't think we're able to achieve the target we're looking at.
Before we wrap up this conversation, I'd like to take your thoughts on how we could perhaps improve it next time if we were to do anything like that. But let me come back to Mr. Martey. Mr. Martey, I am sure that you'd want to react briefly to what Mr. Arthur has said, but what I want us to focus this part of the conversation on is the cost incurred in distributing this water or implementing this intervention. Mr. Martey, are you there? I think you are speaking, but you are muted. Okay, we need to get you to unmute and check the sound again. But Mr. Arthur, while we get Mr. Martey to unmute, what I want to find out from you is that people are asking for an extension. There are people who think that, well, let's get into the new year a little bit before you take away the free water. There are people who are making, who are saying we didn't benefit from it anyway. So, they're just indifferent. As a consultant in the wash industry, what would you suggest we did? Is it realistic to even say, let's carry this on a while longer?
First, it's not realistic because someone has to pay for the cost. I'm not sure even what Ghana Water and the Community Water has delivered. They have received a full complement of the payment from the government, and they require these resources, which is like the fuel for them to operate. So whilst we argue for sustaining the service, it's also not sustainable because one, Ghana government itself does not have the resources. CWSA and the Ghana Water Company also are struggling. because we have not been able to pay them, they have to maintain the facilities, they have to procure logistics to enable them to perform. Therefore, I don't think, even if we want to extend, let's look at these issues on the ground.
Okay.
Secondly, we also extend at the expense of those who still don't have the service. What do we do with those people?
All right.
So for me, if we're going to continue, then let's find a way of extending to those who don't have. And secondly, ensure that the service providers are receiving what they have provided for.
Very well. Let me bring in Stanley again. I think I do have him now.
Yes.
And the sound is good. So, Mr. Martey, I was saying that I'm sure you had a quick reaction to what Mr. Arthur has said earlier, but then I wanted us to focus a bit more on the cost. And he ended his second submission on the cost component as well. How much did it cost us?
Okay, so after today, we'll be able to cost the entire program, because what happens is that we're not giving government absolute figures. We were giving them real figures. So we'll read the meters, and then we'll send a bill to government to pay. So today being the last day, we are hoping that the last meter will be read today, and then it marks the end of the free water policy.
But we
then,
sure have an idea.
A week or two, we should be able to put everything together.
We should have an idea. Sorry, I get the point, but we should at this point. So if we have the final meter to read, to collate to put the figures together, we should have an idea how much, a rough idea how much it's cost us so far, shouldn't we? You should have that.
Yeah, yes, but I can't provide that now because I need to give you exact figures, okay? And every month the consumption goes high, so every month the bill is different.
Okay.
And so let's finish everything, put everything together, and then we'll put the data out for every Ghanaian to be aware of how the whole thing went.
Okay, so help me understand a little bit. I know you want to bring the hang on, Mr. Stanley. I know you want to bring the next point that you were making in, but just to clear, this is just a follow-up to what you just said. You said it went on for 9 months, right? There was the first, I think, few months, about 3 months, before it was subsequently extended. The first 3 months, do you have an idea how much it cost us for the first 3 months at least?
Unfortunately, I'm not in the office and I don't have the exact figure with me. But we started with 60 million Ghana cedis a month. And then as of November, we had exceeded 100 million cedis in a month. And this December, the projections are that it's going to go higher than in November. So let us hold on. When we are done with everything in about a week or two, we'll hold a press conference and then we'll put out the outcome for the general public.
Have you received any intervention of sort? I mean, anything at all from government so far, or that's not how it works?
Yes, government has paid our bills up to October, and then we are hoping that November would be paid soon. We are yet to submit the bill for December because the last meter will be read today. Then in about 2 weeks, we will submit the bill to government. Okay. So the whole thing was like, there's an audit throughout the process. Okay, so if we read the meters in a particular month from the district will hand over to the region. The region will have to audit what the district has done before submitting to the head office. And then the head office will also do an audit of what the region has done. Okay. And then we'll also submit to the Ministry of Finance through our sector agency, the Ministry of Sanitation and Water Resources. They will also do due diligence, and then based on that, they'll pay. This process takes about 3 weeks, and then government will take about a week or two to pay. So in all, we submit a bill, and it is paid in about between a month and a half. Okay, so we have our payments up to the month of December, and we are hoping that November will be paid soon, and then when we are done with that of December, it will also be paid latest in February. And then everything goes on well. But so far, it's been good. Okay.
Is it realistic for the Ghanaian taxpayer to believe that this intervention has not impacted your ability to process water cheaper in any way? Because before this, you had indicated that activities of galamseyers or activities of illegal small-scale miners were having an impact on your ability to produce, the cost of production. So with this intervention coming in at that time, which was necessary, by the way, is it realistic for someone like me who pays tax to feel that we haven't really given you more problems than you already had?
I think there's no correlation between the two submissions. Okay, so they're independent on themselves, so we need to analyze them differently.
Okay.
Okay, so for us, the fact that government is paying everything in bulk, it's inures to our benefit. Because at the end of every month, if it's not government, then it means we have to be roaming around chasing people to pay advertising and doing all manner of revenue mobilization to enable us to collect our money. But if within a month and a half, government can pay everything in bulk and at once, then I think it's rather inures to our benefit.
All right.
So, and it has no impact also on the, or its impact on the cost of production. No, it has no impact on the cost of production because if, for instance, Galamsey is ongoing, the cost of production will still be high even if government is paying all our bills.
Right.
You understand?
I do.
Yes.
Okay.
So that is why I want us to handle them independently.
Independently.
There's no correlation
it makes
at all.
total sense. It makes total sense. There was a point that you wanted to make. I'm hopeful that you haven't forgotten, which I think was a reaction to what Mr. Arthur said. You might want to put that in now.
Okay, thank you very much. I think in his second submission, he did a bit of correction in that rural water is handled by Community Water and Sanitation Agency, and then GWCL handles urban water. And like I said initially, I can say upon authority that every Ghanaian benefited from the free water policy in one way or the other. The policy ran over 9 months, and throughout the 9-month period, I am sure everybody had access to some water. You know that we mounted poly tanks and then we will fill them with free tankers. And then even with private tankers who were selling water to consumers, what we did was to give the water out to them for free, so that what they delivered to customers and sold to customers was their services and not the water, because the water component actually is free. So although you were buying water from a private tanker, you were only paying for the services of that tanker, because one, that tanker will have to buy fuel, that tanker will have to work on, will have to take something on the depreciation on his vehicle, and then some profit for himself. But then the water component that adds up to the total cost, hitherto what you were paying will be different from what you were paying throughout the COVID era or the free water era. And it is because we were serving the water to these tankers for free. So yes, on authority, I can say that everybody benefited. Even if you were buying water in your home, you visited somewhere else and then consumed water for free. If you were even buying packaged water, okay, you were drinking, it was your choice to drink packaged water, but at least throughout the 9-month period, you were not only consuming packaged water, you were using packaged water in washing down, you were not using packaged water in washing your hands or cooking and other domestic chores.
I think
you used
Mr. Martey,
tap water from the Ghana Water Company Limited, which was free at the domestic level. And let us take note, at the domestic level. So even if you work in a commercial entity and you were paying in your commercial entity, when you got home, you consumed water through the taps for free.
Okay. So I get the insistence. I get the insistence on your part. I get the insistence on your part that everybody benefited from the water intervention, and the argument that Mr. Arthur makes is that they went on the ground to check with people, and there were times where people had, it's not like the one day you indicated, like for 3 weeks,
yes,
people didn't have water.
Admit,
and I just wanted to
admit.
Okay.
We admit that water was.
Mr. Arthur, let him land with the point, then we'll bring you in. Yeah.
Yes.
Go on, Mr. Stanley.
Yes. So we admit that water didn't run through everybody's tap through every day, 24/7 throughout the 9-month period. I indicated that in some areas we had a bit of challenges, okay, because consumption went high. So we had to ration water. Now, in the course of rationing water, people had water flowing for 3 days or 4 days in a week instead of the 7 days in a week. Okay, so if you got to a point where water was not flowing, it didn't mean that
throughout the 9 months period, water didn't flow.
You didn't benefit. Okay, I get that side of the argument.
The taps.
Yeah.
Yes.
Mr. Marty, I get that side of the argument. Mr. Arthur, you wanted to say something. I want to bring in some of our viewers. Some of them have been sending us messages from their various locations and what happened there. Mr. Arthur, do come in on that and let's try and wrap up afterwards.
Yes, I will still insist that it's not every place that the services reach.
So the argument he makes is that it's not like everybody, you know, for those who didn't even get it, it's not across the 9 months. That
Mr. Arthur should know.
Okay, Mr. Marte, hang on for me.
We don't have our distribution mains
Mr. Marte,
in most areas.
Okay, Mr. Marte, hang on for me. You know, I made you finish your point, so let him finish his point, and then you come back.
That's fine.
Yeah, come in the back of
that is what I'm trying to say. There are the infrastructure, the distribution main. They are not reaching every place.
Okay, so the point he makes, Mr. Arthur.
And the point is that...
Sorry, Mr. Arthur, let me just clear this out. The point he makes is that there are people who may not have benefited, you know, on a particular day, a particular week, or a number of weeks. But across the 9 months, certainly everybody has benefited somehow. Even for those who did not have the infrastructure, as you said, that they had, you know, gone through with the poly tank and the tankers. You know, so people, some way, somehow, each Ghanaian benefited across the 9 months. That doesn't seem to sit well with you.
Yes, because this place that I'm talking about, they've been buying water, the 4 gallon, 70 pesos, 80 pesos. So it's not an issue of 3 weeks, 2 months out of the 9 that they don't have water. It's a persistent challenge that they have. In fact, one of the officers, I think at the Eastern District, the east of Accra district officers, we talked to some of their staff there. We went to some of the communities for them to explain some of the things that is happening. So it's not an issue of 2, 3 weeks, 3 months, they do not have water. It is something that has been there.
Okay.
And when the free water thing came in, issue is still not addressed.
Okay, I want to bring in our viewers at this point. Mr. Marty, you can make your point.
Can I make a point on this one?
Yes, I just wanted to quickly bring in our...
Just a quick one.
Okay, do make it brief
to benefit all of us. So, Mr. Arthur makes a good one point that I think I want to assert. In that, if, for instance, the money is channeled to the free water, okay, it's channeled into, let's say, extension of pipelines, expansion of our treatment plants. Yes, for everybody to benefit, or to have the water or access to water close to the person. Yes, that is a good point. But the thing is, government also did that based on a certain context, and we need to accept that. We can all fight that so that the Ghana Water Company Limited is supported so that we could extend our pipelines, expand our treatment plants and all that, so that at least we all can meet our target of 100% access by 2030. And that is fantastic.
So I think the one key point for me there is that there is the need, or what this intervention has taught us is that there is a need to expand access, right? Exactly. By providing the necessary infrastructure. Okay, let me read to you some of the messages. This one says, we the people of Huni Valley did not enjoy the free water due to inconsistent flow of the water. Ebenezer Chineboa sent that one in. Let me read this one as well that says, frankly, the water rather benefited the rich and very low % of the poor. In all, we had less than 30% of Ghanaians. I bet you we are going to pay it back from January 2021. My final comments from you both will be on the back of these messages. And let me take this last one. Zach in Ejura says, I connected water in February and I started enjoying the free water. But because it is free, the water company will deliberately lock the water more than a week before you get only 3 days. In fact, water company did not try at all. There are people who have praised you, by the way. We just don't have time to read all those messages. So final words from you, Mr. Arthur, yours first, and then I'll end with Mr. Marty.
I think that the intervention policy was a very good idea. I think the issue is the implementation in terms of what we've just discussed, in terms of the infrastructure reaching people and people having the access. Secondly, and I think probably what we have not addressed is the rural areas. What were the issues? Because if they don't have the facility at all, the infrastructure is not there, the borehole is not there, what were we doing for them? So going forward, I think because the way the COVID came, we did not actually sit down to go through all the rudimentary planning processes. So this gives us a learning platform for us to look at and probably do a kind of emergency planning and put in place, or put it there as and when some of these things take place, we bring it for implementation. I hope that the investment that Ghana Water and the community water requires will be provided to enable them to expand and improve on the services so that a lot more people will benefit going forward.
All right. Thank you very much. Mr. Martey, I'll end with you. In fact, some people believe that this free water will end up somehow paying for it in January. And most of them have sent me messages, but like I said, I don't have the time to read it. Let me take your final words on that.
Okay, so at times, for instance, are done and submitted to us by the PULC. So, and the PULC has its own way of calculating.
Okay.
For us as Ghana Water Company Limited, our input is only to submit our reports, and then based on the reports, PULC will work out the tariff and send to us. So I can't say anything that we may have to be paid, or we will be paying for the water maybe in due course. I can't speak to that because we do not have that authority. But customers should be assured that government has paid or is still paying for the water that they requested that we supply Ghanaians to consume for free, and that has been well implemented. And the lessons that there is will also be taken on board, and then we will re-strategize into the new year and see how we can serve our customers better. I think so far it's been a good year for us because we've been able to supply even when demand has gone higher than we expected. And then government has also done well with its payment, and I think everything is fine. For people who do not benefit, those who do not benefit the way they expected, and I'm choosing my words very clearly, the way they expected, we will still apologize to you and hope that in the new year things are going to change. Now, there were others who connected to our division meetings without recourse to GWCL because it was a free period. And then there were people, especially opinion leaders, that parliamentary candidates at the time, and then opinion leaders like assemblymen, chiefs and all that, who just had plumbers to connect water for the communities to consume. Now it is over. We expect that they are going to come forward so that we will regularize those ones and meter them, and then they can pay for it. We'll give them a grace period for about a month or so, and beyond that anyone that we see will be seen as illegally connected, and that person will be dealt with according to the law. Our legal department is also compiling those who were owing prior to the free water policy and have still not paid. And such people will also be prosecuted after a certain grace period given. So we expect that all Ghanaians will support the GWCL so that we can also serve it better, because the little money that we collect in terms of revenue I've invested back into the system so that we can serve the general public effectively. So we expect the support of everybody, and we hope for a beautiful and a very good 2021.
Thank you very much. Thank you very much, gentlemen, for your time. Corporate Communications Manager of the Ghana Water Company Limited is Stanley Martey there, and we also spoke to Ben Arthur, who is a consultant in the wash industry. So just a few takeaways there for you. The Ghana Water Company Service is looking to regularize those who did, connections just to get the free water. They said, come to them, regularize it. Otherwise, you're committing a crime. After a while, 60 million cedis have been paid so far in November. No, by November, 100 million had been paid. And December, we're waiting for today's bill to add that. So government will pay the Ghana Water Company. This is still The Pulse with me, Gifty Ando up here. I want to take a very quick break. We'll be right back.
So far, they have found that the 57 suspected cases, as of today, Wednesday, 11th March, have proved negative. However, it is imperative that we step up our preparedness to ensure that beyond these initial satisfactory measures, we adopt a whole-of-Ghana approach in adequately preparing for a possible hit within our borders. In order to do so, at my prompting, the Minister for Finance has made available the CD equivalent of 100 million United States dollars to enhance our coronavirus preparedness and response plan. That is to fund the expansion of infrastructure, purchase of materials and equipment, and public education. I have, as of yesterday, ordered the suspension of all international travels by public officials, except for critical assignments, which will have to be authorized by the Chief of Staff at the Office of the President. All public officials are to remain within the jurisdiction until further notice. Video conferencing facilities and other technological tools are to be utilized whenever possible for international engagements. I've also instructed further enhancements of the protocols for inbound traffic from already affected countries. Fellow Ghanaians, all of us should, as much as possible, desist from all foreign travels, except the most critical ones, until there's a grip on the virus.
That's President Akufo-Addo there earlier this year, after Ghana recorded a few cases of the virus. Well, it's the biggest health news it has been for 2020. It dominated headlines across the globe. According to Johns Hopkins, over 1,800,000 lives have been lost to coronavirus, and over 82 million cases have been reported globally. That's a pandemic that has completely changed the world, forcing governments to shut down places of worship, schools, recreational centers, etc., and locking us all up in our rooms at a point. The coronavirus took a toll on all of us, especially our gallant frontline health workers, so who we will be hearing from shortly. Joining me via Zoom now is Dr. Justice YANKSON. He's the General Secretary of the Ghana Medical Association. I also have Cecilia Seno. He's a human rights and gender advocate and a public health specialist. Executive Director for Hope for Future Generation. Also joining us on phone, Dr. Patrick Abuaje, Director General of the Ghana Health Service, and KARIKARI-BOATEng, Head of Laboratory Services at the FDA. So it's a full house. Lady and gentlemen, you're welcome to the show. Thank you for your time.
Thank you very much.
Dr. YANKSON, let me start with you. It's been one hell of a 2020, hasn't it?
Exactly so, but thank God we've managed to raise the storm. And I think as a country, in terms of managing, we've done quite well. The world has acknowledged our efforts.
If you were to review 2020, you know, in a few minutes, I know the coronavirus dominated. You can talk about coronavirus if you want to, but to what extent did we neglect other health concerns that require, you know, some serious attention?
Okay, let me put it this way. Yeah. Corona basically took all of us, you know, just at a point where we were not ready for it. Let me put it this way, as a world community.
Yeah.
But once it came to our shores, then we were compelled to basically try and revise and review the way we operate just to accommodate COVID-19. Now, in as much as we did not intentionally go out there to neglect the other health concerns aside of coronavirus or COVID-19, the pandemic itself brought up a situation where we were forced to scale down on some activities that routinely we were undertaking in the health facilities. For example, we had to suspend some surgeries, what have you, all because the focus was on COVID-19. COVID-19 patients were occupying some sensitive places within our health setup. For example, the ICUs. You need an ICU to, let's say, nurse or manage patients most times right after surgery. Here we were, most of them had to be downgraded to enable COVID patients take over. So some surgeries will have to be suspended. Our OPDs were usually crowded to start off with before COVID. But once COVID set in, we're compelled to scale down on OPD attendances just to ensure that physical distancing and all the bits are in there. Beyond that, there was also the higher risk in the health facilities. So ultimately, you could see that the other health problems, I would say, were sort of downgraded slightly, not because that was our wish, but it was just the circumstances. But by and large, we also managed and became a lot more innovative, tried to reach out to a lot more people via technology, video, conferencing, normal phone calls, what have you, to try and fit in. So telemedicine, for example, became one of the tools that we were using to manage patients remotely. These patients hitherto probably had some chronic problems. They will always come to the hospital for their drug reviews and what have you. So I think it was basically a balancing act to some it, just to accommodate the impact of COVID on all of us.
A balancing act to accommodate the impact. I would love to end this conversation by asking what lessons we have learned to move on into 2021. But let me bring in Cecilia Seno. She's a public health advocate, Chief Executive Director for Hope for Future Generations. Madam Seno, I know that you work a lot in rural communities, focus on public health over there. To what extent would you say the year, how would you review the year in terms of health generally?
Yeah, thank you very much. Good afternoon, and good afternoon to your listeners. It has been a very difficult year, even though we started very well, as the previous speaker has just said. Coronavirus has changed a lot of things, especially at the communities that we work in, especially among civil society organizations, among our beneficiaries, persons living with HIV, persons living with TB, and all other families who really have these challenges. The issue is that, yes, novel coronavirus has changed many things because it's a disease that many of us are not aware of. The virus has really disturb our normal plans and interventions as health advocates. For example, I will talk one about our health facilities. I know Ghana Health Service, for that matter, Ministry of Health, have really put a lot of strategies in place to address and respond to other diseases, but unfortunately, a number of diseases were not the focus during the year because coronavirus tend to be more emergency than others. For example, for HIV positives, during the lockdown, it was very difficult for persons living with HIV to access their ARVs, antiretroviral drugs, because the facilities are more particular about coronavirus than HIV, which we think that HIV is more chronic, is not emergency. Immunization and mothers were finding it difficult to go to facilities because it was difficult to assess. Focus has been basically to persons affected and infected with coronavirus. So that is what I would say. If you look at other diseases like malaria, TB, and the rest, it also affected our interventions as civil society organizations. Our health education interventions have gone down. It was difficult because you cannot travel to many of the communities that we work in, mobilizing communities, educating them, educating others on maternal health issues and all other basic things. So I think I would say that has been our challenge for 2020.
Very well. Let me bring in the Food and Drugs Authority. I have KARIKARI-BOATEng. He is the head of laboratory services at the Food and Drugs Authority. Mr. KARIKARI-BOATEng, you've heard the GMA indicates that it was a balancing act, essentially. It wasn't like people deliberately, that as a country we deliberately overshadowed the other diseases. It was inevitable. But it's also given us some ideas when it comes to testing, our testing regimes, etc. You do speak to the testing regime and what the future looks like for the virus, especially on the new strain or the virus that we're getting to hear of.
Okay, yeah, as it was said, it's been a challenging year, but out of challenges bring innovation. Before this year started, I mean, we had about only 8. I'll talk about equipment later, but we had about only 8 sanitizers on our register, and they were imported. Nobody knew we could manufacture sanitizers here, but now we have 1,000, and over 90% of them are being manufactured locally, and they all qualify. They all meet the international quality standards for hand sanitizers, that's with respect to the alcohol base.
Did you say we moved from what, 8 to 1,000?
Yes.
Wow.
Yes, 8 to more than 1,000, yeah.
Okay.
And then the jump was all due to local production, not importation.
Okay.
And we were the first, no, like us at night, on record, Ghana is the first country to develop specifications for cloth marks, which was done in-house at the FDA together with the Standards Authority. So, yeah, that is it. And also, when it comes to the authority upgraded its capacity in terms to assess products used in the diagnosis of virus, meaning that's molecular biology and then molecular diagnostics. So then let's come to your question about, you asked a question about the new strain, yeah?
Yeah.
Yeah. For now, we don't think that, no, yes, the FDA is monitoring it carefully, yes, with all the PCR kits and then the antigen kits that we have approved for use in Ghana for the detection of the SARS-CoV-2 virus. We have 21, we have 18 PCR kits approved, and then 2 antigen kits approved. Yes, the one at the airport is at antigen, and we just approved one recently. Yes, there has been some mutation, but then if you know, the mutations that have occurred are only in the information available now, only with respect to the spike protein. The SARS-CoV-2 VU1 2020-12/01, which was detected in the UK, there are about 8 mutations. And they are all with respect to the spike protein, the protein that attaches to the epithelial cell for the virus to invade the respiratory tract and then cause infection. And the 8, I think, like, you know, protein is made up of amino acids. It's amino acids that make up protein. If you look at, there have been deletion of the amino acid 6970, deletion at position 44.
Okay, that's all very technical right now. If you can so break it down to the English that we can follow.
Okay, all right. So this, but then the devices that have been approved, especially with the antigen kits, that one, the target is the nucleoprotein. The kits, they are designed with antibodies to capture the virus, that's antigen, with the nucleoprotein section. So far, all the information available, there has not been any serious mutation, or there's not been any reported mutation with respect to the nucleoprotein. So for now, the detection of the virus, the antigen or the virus by these machines, the one at the airport and the one that was recently approved, wouldn't be any problem at all. Now, if these variants get in, they will be detected. And of course, with the PCR, they target multiple genes. We have the ORF, the E gene, and the N gene. So far, the E gene and N gene, no reported mutations there. It's in the open reading frame that there are mutations. But of course, 3, you can detect 2. So that is not a challenge.
I'll come back to you, and let me bring in Dr. YANKSON once again. Dr. YANKSON, I am wondering, going into 2021, seeing that there is a new strain, at least across the world, in some parts of the world where they have seen major casualties, what is the Ghana Medical Association's expectations going forward?
Hello?
Hello. Hi, Dr. Yankson. Please go ahead.
Yeah, could you kindly repeat your question? I lost a bit of it.
Yeah, I'm looking at the health workers like you, what your expectations are going forward into 2021, considering the new strain that we're hearing about and what the FDA has just explained.
Okay, so let me just touch briefly on what Eric said.
Yeah.
You know, when he was trying to describe the changes, the mutation, you said he should bring it down to our everyday use. Take it like, say you have a coconut, okay? The outer bit, the greenish bit, is where the changes have happened. The fruit inside, which is the nucleus, the changes haven't happened in there. So that's what he was trying to say, that it wouldn't affect so much our ability to test and get it right.
Okay.
I hope you get it. The focus is on the whitest part of the coconut fruit. The outer bit is where the changes have occurred. That is not so much of the problem, because the testing will be focusing on the inner bit, which is the whitest bit of, say, the fruit.
Okay.
So just to sum it up that way.
Yeah.
Now, to your question, if we look at ourselves as health professionals, throughout this pandemic, I must say we were really stretched, and our commitment levels were, our expectation is that, one, the general Ghanaian populace will adhere more strictly to the preventive protocols so that we limit the number of infections going forward. Two, based on all the lessons we have learned so far this year, we think that our ability and our expertise in terms of handling COVID-19 will be much, much, much better, even though at the onset, we have been judged as one of the best countries in terms of care for the patients. So we are expecting that 2021, our management skills, our protocols will all be an enhancement on what we have currently. In terms of prevention, the general population, we are expecting that they will adhere a lot more strictly to the preventive measures so that we reduce the number of cases. And then in terms of managing other non-COVID cases, based on the lessons we have learned and the technological innovations and investment that have been done, we'll be able to deal with a lot more of the cases that hitherto, probably because of lack of technology and the fear of the unknown about COVID-19 and all the bits, sometimes prevented people from getting access or the right access to care. But above all, the vaccine could be the game changer. And it is our expectation that with or without mutations that have occurred, the variants that we have in the system, the vaccines that have been produced the world over will help slow down the entire pandemic. And then hopefully we should be out of this hula balloon, maybe within the shortest possible time. That's our expectation.
Have you heard anything about the conspiracy theories about the vaccine? Because you mentioned the vaccine. We've heard a lot of them already.
Yeah, to be honest with you, we expected these conspiracy theories to happen. This is not the first time the world is going to use a vaccine. Vaccines have been with us for a very, very long time. Until date, the ones that we have used for decades, polio, what have you, we have seen the results. The results far outweighs all the negative comments and the conspiracy theory. But these people who are engaged in these theories will never stop engaging in same. The key thing is that we'll continue to educate people to understand the importance of vaccination. And when the benefits are there for everybody to know or to see, I'm quite sure that a lot more people will disregard these conspiracy theories. Issues like polio, for example, let's take a disease like polio. For so long a period, polio was a big problem for all of us. But if you look at our record in recent years, as a result of the vaccinations that we consistently did to more or less prevent people from getting polio, the number of polio cases in Ghana and even the South region and the world have dropped. So vaccinations have always been beneficial ultimately. except to say that these theories are there. We are very much aware. We will continue to educate the populace and also urge the populace not to focus so much on these conspiracy theories because they don't help ultimately.
Okay. I'll let you go because I understand you need to go. But then personally, how has the pandemic taken a toll on you and your colleague health workers, if you were to review it that way, on a very personal level?
Well, to be honest with you, first and foremost, I must say I'm thankful to God. I've not come down with COVID. I've tested, countless times. I was really in the thick of events when the pandemic got to our shores. I was a member of the Emergency Operation Committee at the highest level. I was part of the people who were doing all the advocacy, the social mobilization, what have you. I was part of the people who were trying to get some of our treatment centers in place because at the time we were not really using those facilities that existed for COVID management. I was always in touch with the case management people. Sometimes I had to see some patients along the line. Beyond that, I was also involved in the construction of the first Ghana Infectious Disease Center at Kabenya. It was a lot. I was all over the place. It took a big toll on me in terms of the pressure, in terms of your inability sometimes to be closer to your family. There were times that I was detached from my family just to make sure that I limit any potential risk that I may be carrying home as a result of my being part of the front line people who were all over the place. And then even within the clinics, the risk was always there. So it took all of us. But to be honest with you, I was never going to give up because I believed that, look, men and women will have to stand up and confront this head on.
All right. The
problem is that it cannot be resolved by one person. We need all hands on deck. Okay. And being a professional who was confronted with this, I told myself I was going to face it head on. And thanks be to God, we've all been good. We lost some members of our medical community. Some were our teachers, some were our mates, some were our juniors. It was a tough time. Some of the people were personal friends, and the impact was that much. But at the end of the day, we were all committed that, look, as health professionals, whether we were doctors, whether it was the nursing staff, the laboratory people, anybody who was involved, including the everyday, with all due respect, cleaners, orderlies, whatever, people were committed. Some got infected in the line of duty, and it was that bad. Some lost their lives. But after paying the ultimate price, I think that if you look at the global picture, our sacrifices have really put Ghana up there in terms of the countries that were able to manage this very well. And we are grateful and happy for those outcomes, except to say that we'll still urge the community to remember that COVID is real. It is still here with us. People keep testing positive on a daily basis. People keep getting admitted into the health facilities. We should not lose our guard at this point.
All right.
We need to ensure that, especially going into the days and weeks post these festivities, where a lot of gatherings are happening, we'll be able to go out there and test as many people as possible and make sure we address any potential risk out there early so that we don't have significant community spread. That is the only way we'll survive, because as a country, our best bet is the prevention, not the curative. We've been good at the curative, but our capacity, if we get to the levels of the UKs of this world and what have you, we can never handle that. And we pray to God we don't get that. But we need to back that with a physical bit, which is the preventive bit that the general population will have to adhere to.
That's true. Thank you so much, Dr. YANKSON, and do convey our gratitude to your other colleagues. We really appreciate them. We don't take their efforts for granted at all.
We are also grateful, and let me also take this opportunity to thank all of you, the media, especially multimedia, for your yeoman's job in ensuring that you made sure everybody understood what COVID was all about. You made sure that all the preventive protocols were known by everybody. We are very grateful to you as well.
Hi.
Have a prosperous 2021.
You too, and I'm sure we'll be here to talk more about how we're handling the coronavirus on the other side of the year.
I'm sure.
Dr.
Thank you.
Right, you're welcome. Dr. Justice YANKSON is General Secretary of the Ghana Medical Association. He's leaving the conversation now, but I still have KARIKARI-BOATEng, who is Head of Laboratory Services at the Food and Drugs Authority. Dr. Patrick Abaji, we're expecting to, have him on the phone as well. And Cecilia Seno, who is a public health advocate. Right, we do have the Ghana Health Service. So let me quickly go to Dr. Patrick Abaji, and I'll come to you, Eric, so that we talk a bit more about what Dr. Justice YANKSON indicated. But of course, the Director General of the Ghana Health Service is here with us. Dr. Abaji, Happy New Year in advance.
Well, thank you. Many happy returns. Happy New Year to you.
Thank you. So let's take a look at let's take a little step back and review our interventions, our ability to handle coronavirus and other diseases in the year. What is your reflection?
Well, thank you very much. Well, we started the year with some cases of CSM, especially in Upper West region, which was led to a significant number of deaths, but eventually was curtailed. And then we had a COVID, and I believe that there were initial challenges, just like all other countries. But we found ourselves in a way that we thought that we were able to manage. Manage in quotes, because if you lose life and people are falling ill, one cannot say. But by and large, I believe that our response was led by the president and the other technical team was appropriate in containing the disease, especially when you compare to how it had devastated other regions and our level of exposure and how we were able to keep the numbers down. I believe that not just the health sector, but also the people of Ghana participated in their response.
How did it personally affect you? How did this year personally impact you? Looking at your position, I'm sure it was a whole lot of stress.
Well, I would say I've managed crisis, but this was a bigger crisis. And every day there were new issues that had to be addressed, not just ways to address tomorrow, we have to address it immediately. And so we had to spend a lot of time, day and night, working to ensure that we are responding to all the issues across the country, all districts and all communities, as and when the results came. And I had a good team that we worked. But just that was a bit tedious, a lot of work. I think for a month, a couple of weeks, I don't think I had more than 4 or 5 weeks, 5 hours of sleep any day. So
that's very unhealthy. That's very unhealthy, as you, the health experts, tell us, isn't it?
Yes. But you see, when you are responding, you are also looking at other people's health, not just yours. So
okay,
it's a balance.
I want us to talk a little bit about the vaccine, but let me bring in the FDA. Mr. KARIKARI-BOATEng, I'm sure that you are still there. One thing that I wanted to ask is whether or not the FDA has a plan to deal with the conspiracy theories that has just started coming. I'll have Dr. Abaji also speak to it, but what is the localized plan, if any, on the part of the FDA?
The conspiracy theory against the vaccines?
Oh, there are plenty going on around social media. I mean, people are saying that...
The only thing that I can tell you, and then the FDA would like to assure Ghanaians that every vaccine that is approved for use in this country would have met all the standards as quality, safety, and efficacy. And as you know, we have the wherewithal to do that. So we are going to ensure that every vaccine that is approved for Ghana is of the right quality, it is safe, and then efficacious. If it doesn't meet the bar, it would not be approved.
Okay.
That I can tell you for sure.
That said, let me bring in Dr. Abaji. Dr. Abaji, how soon are we to bringing in the virus? How close are we? Sorry.
The first process to get a vaccine that the FDA will approve and then we'll take it from there. And so I'm sure a lot of work is going on, and I know a lot of work is going on. And once the appropriate vaccines are registered, I believe that the system will put in place to quickly vaccinate people.
How will this vaccination look like? Okay, please go ahead.
So I think we have a lot of activities are taking place in terms of getting some through Gavi, and we are also looking at the other ones who, and all of them will have to be registered by the Gavi, with FDA. And once FDA registers them, then it's safe. And just to add that FDA is one of the best, probably the best in the sub-region. And we have faith in FDA that they will give us the right standard. Okay.
I'll come back to you, Dr. Boaji. Let me bring in Cecilia, and then I'll let Mr. KARIKARI-BOATEng go afterwards. But Cecilia, you work at the grassroots. You visit hospitals, etc. To what extent do you think they are open to a vaccination that is coronavirus related?
Yeah, thank you very much. Like any other vaccination, I think the awareness, the whole country is aware of COVID, and everybody is aware that there is vaccine in other countries. So I know people will be willing to take it, but we'll still need to do a lot of education because you already indicated that there's a lot of social media conspiracy theory all over. And you remember when Ebola came, how the trial we will need to really sensitize Ghanaians to understand and accept so that people don't come out with counter information to prevent people from taking it.
So because you deal with the people. Okay, so we have the Director General of the Ghana Health Service listening to you right now. You also have the FDA's representative listening to you. As a social worker who goes to the ground, what will be your suggestion? Will you advise them in terms of how to carry on this process, get people to understand the vaccination process and to buy in and be a part of it?
I would suggest that we do community mobilization. Social mobilization is very important to educate people to understand the benefit of the vaccine and how it will be given. If people accept it, I don't think it will be a big challenge. I only want us not to just go and start vaccinating people, but to let them know. That will be very important, to work together with communities, with civil society, religious bodies, everybody, so when the vaccination starts, we can roll it out successfully.
Okay. So, Mr. KARIKARI-BOATEng, I want to come to you. Is there anything from the FDA side that you'd like to add to this conversation so we can wrap it up on that? And I will stick with Dr. Patrick Aboagye.
The only thing that we say, we'll continue to assure Ghanaians that every health product that we put on the market to fight COVID will be of the right quality and will not compromise the public health, the public safety of the Ghanaian people. That's what I have to say.
How did
people should not forget that the disease is there. They shouldn't say that the disease is gone. They should continue keeping the protocol. Because we've been working like hell Sunday to Sunday for the past, that was from May to July, and now it's coming back again. So, it's better we prevent us. As we say, prevention is better than cure.
I've been taking personal stories. Do share your personal side of the story with us. My personal
story, from the 27th of March to the second week in July, we worked 7 days, Sunday to Sunday, testing sanitizers, face masks and shields. So, a whole lot of things, reviewing applications for this PCR. It's been a hell.
How have you managed your social life, you and your other colleagues? How have you been able to manage your social life and stay sane?
It was a pandemic, and we're in the crisis of a pandemic, and somebody had to do the work. So it really had a toll, especially the Easter. For the first time, for Good Friday, Easter Saturday, Sunday, Easter Monday, we worked through from morning to evening. We didn't even realize it was Easter. But that's service to the nation. So.
All right. Mr. KARIKARI-BOATEng, thank you very much. You and Cecilia Senom, who's a public health advocate, thank you so much. I want to just remain with Dr. Patrick Aboagye, who's the Director General of the Ghana Health Service. Doc, let's talk a bit more about the new strain. What do we know about it?
Well, thank you very much. We know that there's a new strain which according to studies, is a bit more efficient in terms of transmission from one person to another. And what we don't know, what has not been proven, and what has caused a more severe disease than the previous one, so far no evidence has come that it caused more severe disease. We in Ghana, we have not identified them here. We're doing some genomic studies, as for example said, see how whether we do. I think we've done 2 already, and there's a process of going through another one, see whether it is here. But that's all we do. What we are doing is that because of our double-tier testing system at the airport, coming negative before you fly and test you and isolate you on arrival, we believe that is if people who go home on isolation adhere to the protocols, we should be protected from bringing in that strain into the country.
Is there any way we are planning to deal with it should it come? Because sometimes, I mean, when coronavirus started, it was more a matter of when and not if. So if it does happen, what is our plan to deal with it?
Well, our plan is the same virus. So the plan will be the same: test, isolate, and treat. That's what we're going to continue doing. What we are currently enforcing is to ensure that we prevent the importation, because it's not here, it has to be imported. And so we have scaling up our effort and ensuring that those who are tested at the airport are not allowed, who are test positive, are not allowed to mingle with the community until it's okay. So those are the protocols that we are introducing to ensure that we don't bring it in. And then we'll continue managing. So the most important thing is that if you abide by the protocol, as we continue to preach, and I have it and I can't give it to you, the virus does not transmit. And so those are the areas that we need to continue dealing with. There's no treatment for the new strain. There's no treatment for the old strain or the more common strain. And so prevention is still the most important approaching, and also reducing importation.
Okay. I mean, I won't overload you with all of that. I'm sure with time as we go along, we'll be able to unpack it gradually. But let's talk briefly before you go about non-COVID cases. We have learned, we've learned the lessons, I believe. What, upon hindsight, would you say we would do based on what we learned from coronavirus and how we dealt with non-coronavirus cases?
I didn't get your question properly. I took at the beginning. Okay,
so I'm asking whether or not we have learned anything based on how we manage non-COVID cases and what we would do differently based on that knowledge we have acquired this year.
Well, I think one of the most important things is working together, not just in one sector, but all sectors coming together to respond to such pandemics or any such occasion. And I believe that bringing all sectors together and playing their roles appropriately is very, very important. Mobilizing the people is important, and most especially the media to be on your side and also provide appropriate information is something that we thought has been quite good. When we started with a lot of media information and misinformation, it was something that was good. And so we're being proactive and providing the media with the appropriate information early enough, we believe has been very, very useful in a way we should deal with it. So whether it's COVID or any non-COVID issues that come up, I think those are very important lessons that we believe that we must.
Right. I was actually talking about how at the various health centers, how the Ghana Health Service will, I mean, what measures we are putting in place to make sure that we don't allow coronavirus, as it were, and as it has done, to overshadow the other non-COVID-19 cases, so that people get so that people get equal access. Yeah.
One of the things that people have not looked at is the fact that despite all that, we managed to keep services afloat. We lost some grounds in the second quarter, but we caught up because as soon as the pandemic started, we asked my Deputy Director General to take control of the other disease, have a more closer oversight over that. Of course, we're all working on that. Secondly, we developed strategies, essential services packages on how to work. How, if people cannot gather, how do we reach them with public health information? How do we vaccinate children? How do we get pregnant women to come for antenatal care? All those guidelines were done and train all health workers. And as I speak now, the number of, let's say, antenatal care services have caught up. We didn't have any deficit in terms of care. Immunization dropped in the second quarter, but we've been able to catch up. And so we created essential services and then package, and we work with the regions. Every region, we identified a team for COVID, so that these are the 7 people who are responsible for COVID. The rest of you do your work.
Okay.
And that was done early, and that's how we were able to manage both the meningitis and other things. And if you, at the end of the year, as we present our report, we realized that we were able to really catch up on our coverage.
Okay, so hopefully we'll make it better in 2021. Like I said, I won't overload you
so there's a lot
with all of that.
From that.
Yeah, I won't overload you with all of that right now. We're going, to pray into the next year. So if there's anything else you'd like to share with our viewers, please go ahead. If not, we'll call it a day.
Just to thank the media for their work. They kept us on our toes, sometimes for good or for bad, but at least it made us better. It made us do our work well. And then we'll say that tonight is 31st night. It's a large opportunity for gathering. Let's do it properly so that we don't start the year with an explosion of cases, especially in Accra. And so churches and all those people who will be gathering around for whatever function or the other must respect the protocols, wear their masks, so that we can have a better 2021. Thank you very much.
Doc, thank you so much for your time, and we all wish ourselves a better 2021. Director General of the Ghana Health Service, Dr. Patrick Kuma Abwaje there. Well, let me leave you with this message from one of the doctors at the front lines that we spoke to yesterday. She talks about waking up from dreams of people who have died on her hands, asking her to save them. Listen.
Like a whole different environment altogether. You have to change everything, your clothes, your shoes, you put them on one side. And there was a lot of fear because we all didn't know. There was so much uncertainty. Today, and WHO says this, tomorrow says that. So you go to work, and it's to get for our ICU, we had a chart in which had cameras, the monitors, so there are cameras on the patients with the monitors all there. But we have to go inside. Now going inside, you have to don your PPE. And I remember the first time I donned, it was so scary because it's like, okay, what if there's a break here and the person coughs and it goes into your nose or something? Like, it was so scary. But the thing I loved about this whole thing was that I managed to get a family out of it because we all learned to help each other.
Okay. As in your colleagues became family. So, like, there's nothing like, we're your doctor, Juma, this is nurse's job. Like, we are all doing the work. And it was... For our ICU was a national COVID ICU. Okay. So we had that in the East. And so we saw almost all the critical care. Did you see some people die?
Oh, yes, a lot of them, actually, yes.
A lot of them?
Yes.
What does that do to you? Does it make you numb, or does it, make you just an emotional wreck until the next job is up? Okay, so this is a very important question, and it's a question that I think a lot of health workers should be asked. We keep asking each other at UGM, and I really appreciate that. We ask, are you okay? Because we were not okay. You were not okay. We've seen so many people die. National Health Insurance. We've seen so many people die over our work. That's fine, but this was different. I mean, I worked in an ICU at Kolebu before I came to UGMC. So I had worked pre-COVID ICU, during COVID, and I've worked post-COVID in an ICU. It's different. How different? Can you explain? It was. Well, we had a lot of patients dying, ICU patients die occasionally, but it was back to back to back, and it was scary. And some of the patients knew they were going to die. There was one patient, I still sleep sometimes, and I wake up in the middle of the night, and I see him as telling me, "Doc, I'm dying. What are you doing for me?" Oh, that's sad. It's really sad. It was. The work itself got better because we got so much stronger together, but the emotional impact was. And I would go home, and I remember I told my mom, because of confidentiality, I can't tell my mom there was this person or that person. I'm like, Mama,
Today I can't. Sometimes I'll get home and I get to the gate, my mom will come and carry me. It's just so sad because it's all over.
Did you know that the number of COVID-19 cases in Ghana is going up gradually? This is largely because of the relaxation in the COVID-19 preventive protocols. The Ghana Medical Association is calling on all Ghanaians to observe the necessary preventive measures. Let's wear our face masks when we have to do that. Let's observe the necessary social and physical distances. And above all, let's observe the necessary hand hygiene. Be responsible and keep safe. Thank you.
320 deaths so far due to COVID-19. 48,055 confirmed cases at present. Over 500 active cases confirmed. Many more have not reported for diagnosis, and they live among us, in our homes, our churches, our restaurants, our offices. Would you help prevent this second wave, as many countries in Europe are experiencing second waves? Let's stick to the COVID-19 prevention protocols. Observe strict hand hygiene, wear your face mask, observe social distancing.
Keep your distance. Physical distance is still a must if we must avoid a second wave of COVID-19. Think twice before you join a crowd. Is there enough space for adequate social distancing? Before you speak to anyone, take 3 steps back. They can still hear you. Let's all come together to avoid a second wave of COVID-19.
But I've been infected already. Can I get infected again? If I get infected, would I infect others? Wow, there's a lot we are learning about reinfections. But yes, data suggests that reinfections are possible. Therefore, to err on the side of caution, let's continue to wear our mask, especially in public places. Wash your hands frequently with soap and water, avoid crowded areas, and ensure social or physical distancing. Let's help prevent a second wave.
We have seen the impact of COVID-19 on various sectors of our lives. The hard decisions on restriction of movements. It is difficult to predict the outcome of a second wave. Let's all come together, wear our face masks, observe the protocols, hand hygiene, and social distancing. Let's prevent a second wave.
Welcome back to one of our top stories. The National Democratic Congress has for the first time commemorated the anniversary of the 31st December Revolution without the founder, Jerry John Rawlings. The event, which was held earlier today, was attended by the presidential candidate of the NDC, leaders of the party, as well as supporters. Former president and flag bearer of the party, John Dramani Mahama, said the party will uphold the virtues and legacies of the late former president.
Let me thank all of you for coming here to continue our remembrance of the events of 31st December 1981, but also to pay our respects to our late founder, Excellency Flight Lieutenant Jerry John Rawlings, and to say that the flame that he lit in 1981 and has continued to burn for 39 years, will continue to burn forever. Let me commend the smart out-turn of the young people who conducted the parade, because that gives me the assurance that the younger generation that will carry on this revolutionary legacy is already in place. As our national chairman said, 1 year ago we gathered together in Winneba to commemorate the 30th anniversary of the 31st December Revolution. And the founder of our party, chairman of the PNDC, leader of the revolution, former president, Jerry Rawlings, was with us. That morning, he was in very high spirits. And little did we know that we will spend this 39th anniversary just a year after without him, and that death will snatch him in a surprising manner, just as the same way he burst onto the political scene of this country. The revolution was not perfect. As we know, every human event is never perfect. And like any human being, our founder, leader of the revolution, Chairman Rawlings, was not perfect. But the sum of what he did on earth, especially from the age of 33 when he burst onto the political scene of Ghana, and the sum events of the 31st December revolution represent a kind of atonement for the ills of the past. The revolution therefore bequeathed to us the principle of holding to account persons entrusted with public responsibility, since, as we know, sovereignty resides with the people. The revolution also bequeathed to us a growing economy that ensured stability for our country's progress over the years. It also, more importantly, bequeathed to us a constitution that was drafted by the ordinary people of this country. And it is because of the drafting of that constitution by the butchers, the dressmakers, the hairdressers, the mechanics, and other ordinary people of this country, teachers, farmers, fishermen, that has made this constitution the most enduring constitution in the history of Ghana. The constitution of the Fourth Republic has outlasted any other constitution.
John Dramani Mahama there. He's also been speaking about the NDC's performance in the just ended polls.
As a party born out of the events of 31st December, it is our duty to uphold the principles of probity and accountability as a part of our national life and daily practice. Our party has chalked many successes and has also faced many challenges. My brothers and sisters, we went into the last election barely 2 weeks following the death of the founder of our party. Despite the shock of this incident, our party, the NDC, performed creditably in the face of the many challenges that faced us, such as lack of resources and going up against an opponent who had no qualms in using money and inducements, and also even use of brute military force to influence the outcome of the election. Now is a time for us to remain committed and united to the cause of our party. And the question that we should ask ourselves at this 39th anniversary of the revolution is, how do we preserve the principles of the revolution and the memory and legacy of our founder, Flight Lieutenant J.J. Rawlings, for posterity? He said in a letter to me, when we offered to have him named on the FPSO for the ENI Sankofa field, he said, "I prefer to be remembered in the hearts of men than by monuments and statues." And so he did not seek to have his name on monuments and statues. He said he wanted to be remembered in the hearts of men. And I believe that the only vehicle and the best vehicle that can ensure that he's remembered in the hearts of men is the vehicle of the political party that he founded, and that is the National Democratic Congress. Comrades, this is the reason why we must recommit ourselves to the cause of our party, the NDC. I know, like every human institution, we might have our disagreements, but let us have and put as the focus of all of us that protecting the revolutionary origins of our party and the legacy of our founder is the main objective that we all want to achieve. I dare say no one person can fill Jerry Rawlings' shoes. No one person can encapsulate the charisma, the political wit, and the courage exhibited by our late founder. And since no one person can fill those shoes, it means that it will take a collective responsibility for us to be able to keep this party together and make it a vehicle that would live forever and continue to commemorate by the principles and legacies for which it stood. And therefore, I urge that we should recommit at this 39th anniversary that all of us will work together, and that even when we have differences of opinion, we will resolve them in a way as not to endanger the future of our party, and that we will continue to work together as one collective to ensure that the memories of those who laid down their lives for our fourth Republican Constitution is never extinguished. And so on this occasion, I say, a luta continua, Victoria asserta. May the struggle continue, and may victory be our portion. I thank you very much.
John Dramani Mahama there. This is still the pulse. Before we go, the police in Ashanti region says it has gunned down 2 suspected armed robbers after they engaged them in a shootout.
Regional Police Patrol Team today, 30th December 2020, engaged some suspected armed robbers in a shootout, leading to the death of 2 of them. The suspected armed robbers, numbering about 4, had embarked on a robbery expedition at Santasi Kejasi, Otirin Kwanta, and its environs, where they succeeded in robbing occupants of about 5 houses of their mobile phones, monies, laptops, and other personal effects. The police information room and command center received a number of distress calls on the robbery and dispatched police patrol teams within the area to the scene. The robbers, on seeing police, opened fire. The team also returned fire, leaving 2 of the suspected robbers between the ages of 20 and 30 years dead. 2 others, who are suspected to have sustained gunshot wounds, managed to escape. On the spot search at the scene revealed 2 weapons, 1 foreign pistol loaded with 3 live ammunition, 1 revolver with 3 spent ammunition, 2 big backpacks containing 3 laptops, computers, 24 assorted mobile phones, 2 machetes, and a cash sum of 3,580 cedis. The bodies of the deceased persons have since been deposited at the Konfanochi Teaching Hospital awaiting autopsy and identification, whilst efforts are underway to get those who managed to escape arrested. Meanwhile, the command is appealing to the all medical facilities in the region and elsewhere to be on the lookout for anyone who visits their facilities with suspected gunshot wounds to report same to the nearest police station or call the following telephone numbers, that is 1-855-5 and 191, to assist police with information.
Gordon Nahianyo speaks for the Ashanti Region Police. And that's it for Pulse today. There is more news at myjoyonline.com. My name is Gifty Andopia, and I'm not going yet because right at 5 p.m. myself and my colleagues, Israelai, Kojo YANKSON, Elton, Brobe, Gapo, and most of the others will be joining us as we take you back into the year 2020.